This is a nice 55-year-old patient, as you'll see. In 2012, she got what are supposed to be the nicer, safer, better gummy bear implants. And she had a CT scan done, and per CT scan, the right shows ruptured, left one questionable ruptured. So the right one is ruptured. Remember, the CT scan is not the study of choice. The study of choice is an MRI, magnetic resonance imaging, no contrast, so there is no radiation, no contrast, is the study of choice to look for what is a silent rupture. And so as you will see, the entire implant capsule has been removed. I'm very happy and content with how the whole dissection has gone. And I am going to now go ahead and cut this open. So remember, the CT scan is not the perfect test. And let's go ahead and look. And you can see how thin the capsule is. A lot of inflammation. And as soon as I go in, you will see indeed, very much so, it is ruptured. And this goes on to showing you that MRIs are basically are the standard, and certainly the CT scan. And look at the way how this implant is. Look at the color of it. And if I go like this, you will see that it is very much not intact. And so you will see right here how thin the capsular tissue is. All of it was removed completely, sincerely, definitively. This is the capsular tissue, as you will see. But the tissue behind that fatty tissue has also got to go, because remember, it is leaching. The gel bleed is occurring more now because that it is very inflamed. So this fatty tissue, as I cut, is very much part of the culprit. And as you will see, it is not healthy tissue. So it is not only important to remove this capsule, but to remove the tissue behind it as well. And again, the CT scan was indeed very much right. Now, I did not have her repeat I did not have her get an MRI, because I always assumed that the implants are ruptured until proven otherwise. Look at the case I just did before. That patient had implants from 2021, and the right one was ruptured. So this is 100% total capsulectomy on the left. As you can see, this is that pseudo lift, if you will, where I removed that fatty tissue on the side and I put some internal sutures. That really helps with the recoil. And again, look at the way that the boundary is. It is not regular. It's not like a pure circle. And so it is lost its basically the roundness of the implant. So as I cut this open with my new sterile gloves, you will see, let's see what it shows. So this looks like an intact implant. Remember, the CT was saying possible. And as you will see right here, this is an intact implant. But guess what? As soon as I go here, you will see, look at the stickiness. This is gel bleed phenomenon that's occurring. And so this is your intact 350, what is a mentor implant, intact. Look at the consistency of this. And if you look how thin the capsule is, all of the capsule has been completely removed, and even the fatty tissue right here has been removed, so that all that inflammatory burden is removed. So the take-home message here with this is the MRI is the best study, no contrast, to look for a rupture per mentor guidelines. Not my recommendations, recommendations from the manufacturer. You should get an MRI at year 3, and then every 2 years onward, looking for what is a silent rupture. And remember, these are not lifetime devices, silicone implants or sealant implants, and they need to be monitored carefully. So the implants will be returned to the patient, capsules to be sent to pathology, rule out the BIA, LCL, CD30 analysis, rule out lymphoma, rule out malignancy, rule out any of pathology, cultures for Arabic, anaerobic, and fungal, and most importantly, we'll see how the patient does post-op minus these toxins. This is Dr. Khan, Executive Plastic Surgeon.
Have I released myself?